Hi, I'm Edie Hand, Prescriptions for Healthy Lifestyles, here with Dr. Daniel Potts and myself. And Danny, we've got something really important to talk about, our appearance.
Absolutely, and we have a very special guest today, Dr. Galen McCullough, who is not only a football star, but is also a very, very well-respected plastic surgeon.
Internationally renowned. He actually was the president of the association, I know, at one time, and a good friend to both of us that we know, Dr. Galen McCullough. And what he talks about, you're going to find very interesting, not just our appearance for something that makes you feel vain or make you feel better. Of course, that's important, but what's really important is if you've been in an accident, if your child has cleft palate, whatever, you're going to enjoy learning more about what Dr. Galen McCullough has to say, because your appearance really does matter here.
Absolutely, for quality of life for these individuals.
We'll be right back after these messages.
If you woke up with pain this morning, you are not alone. Estimates are that nearly 1/3 of Americans will experience chronic pain at some point in their lives. Optimal Pain Control by Franklin Pharmacy works directly with your physician to create a pain cream for your unique needs. Our staff of pharmacists has over 30 years experience in compounding. OPC by Franklin Pharmacy's custom formulas are created for you to maximize pain relief while minimizing side effects. From minor aches to severe neuropathic pain, let us be your partner.
Enjoy the latest books from Edie Hand. A portion of sales benefit charities such as St. Jude Children's Research Hospital. Visit www.ediehandfoundation.org or your local or online bookstore. Pick up your copies today. A Pocket Guide for the Alzheimer's Caregiver by Dr. Daniel Potts and his wife Ellen helps you understand this disease and get the best care possible. Go to alzpocketguide.com or any online bookstore for your copy. You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
Well, I know that, you've written so many books, but I think what's pretty intriguing to me is that you have an incredible institute right here in Alabama, in Gulf Shores, Alabama, I might add.
Yes, we do. Actually, writing is an avocation for me. I'm still full-time practicing facial plastic surgery in Gulf Shores. We have the McCullough Institute for Appearance and Health, and plastic surgery is just one of those things that we offer there. But we're going to talk today about some of the other things and how cosmetic surgery, plastic surgery fit into one's appearance, health, happiness, and success. And I hope that by the end of the segment that the viewers out there will understand how closely all of these things are related in order to really to create what I like to call the beautifully balanced life.
I think that is a great way to describe it, and it's so important, I think, even at this stage in my life. I think when a woman transfers over into her 50s, 60s, and you start really looking different in that mirror, and you have found a way, I think, to capture a real balance and make us feel beautiful, and that's a high compliment, I think, to you.
Well, not only women, but men.
Well, you're right.
We're seeing a growing segment of the individuals who are concerned about their appearance to be men. When I started in practice some 37 or 38 years ago, only about 5% of the patients that we saw were men, and today that's up to about 35 or 40%.
Well, speaking of men, most people in Alabama know you, Dr. Galen McCullough, but some people that might not know the history, talking about men, you certainly are connected to one of the legends of our lifetime, an icon, Bear Bryant, and you wrote an incredible book, I think one of the best books about him. Would you share a little bit with our viewers about the book and
I will.
And what that experience was like for you getting to know him as a college student?
Well, it was quite an experience. As a college student, I went to the University of Alabama and had an opportunity to play football there and was a member of one of the national championship teams, 1964. And I got a great education during that period of time. And of course, Coach Bryant was my coach, but as a player, you really never know your coach. And it wasn't until later in life, and as a matter of fact, as a result of a gentleman right up the road from here, whose name was Ellis Taylor, who was a good friend of Coach Bryant's. And Ellis saw that I really became part of Coach Bryant's inner circle. So I got to know him from a totally different perspective later in life and became one of his doctors and one of his confidants. Coach Bryant was very, very ill in the last few years of his life and was struggling with what to do and whether or not he could finish out his career. And he shared a lot of his concerns with me during that period of time. After he passed away, I sat quiet for a long time, and I never really shared any of those conversations with anyone other than my immediate family. But I could see that history was being written incorrectly. There were a lot of people taking liberties about what Coach Bryant might have said, what he might have thought, and I could see that history was really heading in the wrong direction. And so I decided about 5 or 6 years ago that it was time to set history correct, or set it straight. And so I wrote The Long Shadow of Coach Paul Bear Bryant. And in the book, I share a lot of the conversations that we had, some of his concerns, some of his worries, not only personally, about the University of Alabama. And I also shared what many times people refer to as the secrets to his success.
That's pretty cool in itself. You know, and I also know that he had a little plastic surgery too, didn't he?
Well, he did. I never would have told anybody about it, but after his surgery was performed, actually it was an interesting story. One of the men who dealt him fits for years was a writer from the Atlanta area, from the Atlanta Constitution. And he had picked up on the sidelines of the first game that Coach Bryant was looking a little younger. As a matter of fact, wrote in his article that Coach Bryant was sporting his new face on the sidelines during the Alabama-Georgia Tech game. So he wasn't going to let Furman Bisher get the scoop on him. And so he started telling everybody about his surgery after that point. And so I never would have, but he divulged it, and he was very proud of it. And actually, it was a business decision, because later in life he was getting opportunities to do a lot of commercials because he was approaching the more wins than any other coach alive at that time. And his agent told him, said, "Coach, you're really looking bad on camera," and said, "You need to have a little nip and tuck here and there." And so Coach Bryant liked making money almost as much as he liked winning football games.
I remember that much about him myself.
So he decided that it was time for him to have a little tuck up in order to look a little bit younger.
You know, I love that, because talking about in your book, the appearance factor, you know, for someone of his stature, and I know you've had a lot of giants to probably come to your institute and in privacy, and I know, how does that affect, you think, to them psychologically, you know, as we get geared up for that, for gentlemen? Do you think it makes them feel really good about themselves too?
It really does. Most men who have this work done do it for economic reasons. Perhaps they see themselves looking a little bit older and not getting quite as much respect at the office as they might have had earlier in life. And they realize that in order to really look as good as you feel, you have to have a little bit of help. And as we get into this program today, we're going to talk about a lot of other things other than surgery that an individual can do. Another group of people that we see are those individuals who have gone through some life-altering event. Perhaps they lost their wives, and they are looking at maybe getting out back onto the dating scene again and getting remarried, or if maybe their marriage fell apart as a result of a divorce. Sometimes they will have children that are younger, and so they start going to PTA meetings, and they're looked upon as the child's grandfather rather than father. And so this happens with both men and women who have children later in life, that they come to have the surgery done, really to prevent an embarrassing situation in the environment where they're with their children.
You know, what I love too about your organization there at the Institute is that people can come with discretion, because they can stay there, can't they?
Yes. One of the things that we really pride ourselves in, not only in that we try to do the quality of work and make it as comfortable and convenient for people as possible, but the privacy that we offer there. We're a full-fledged, self-contained surgical center, and we have the ability to do the surgery there and for people to stay right there on our campus and to recover in one of our villas or suites. And we can check them every day while they're there. And I think they're much more comfortable, and we can do it without anyone knowing that they've had the surgery performed. And that's important, particularly for high-profile individuals, but many times just someone from a small town who doesn't want everybody in town to know that he or she has had a little work done. They want to get out of town and hide, and we have the ability to do that right there at the Institute in Gulf Shores.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts. We'll be back in a moment.
Sure, Toyota is #1 for everyone. But Scott Crump insists on more proof than just statistics. Yeah, the all-new redesigned 2012 Camry has more room, better fuel economy, and plenty more performance. And right now at Scott Crump Toyota, you too can drive the new Camry from just $199 a month. Did we mention better brakes? Visit Scott Crump Toyota in Jasper.
We'll do whatever it takes.
Hi, I'm Sarah Evans here with friends Rollins and Kumar, who've been helping Children's of Alabama celebrate its 100th birthday. They're here for care at the Alabama Center for Childhood Cancer and Blood Disorders, the largest provider of cancer care for children and young adults in the state. At Children's, we treat every form of cancer, and we're committed to a cure. You can be too. Donate now so thousands of kids like Rollins and Kumar will celebrate lots of birthdays, including their own.
You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
So what can we talk about that would really, you think, impact of showing these procedures of before and after and sharing some stories of some of your patients that's made a difference like this?
Well, Judy, I'm sorry.
That's
Edie,
all right.
The one message that I would really like for people to take away from my comments on this program is that you really can't separate appearance from health and happiness and success. In our culture, in our society, it is so closely integrated and symbiotic so that if you improve your health, you're going to look better. We found many years ago, and that's why I built the institute that I had here in Birmingham before I sold it and moved to Gulf Shores and built another one, is that if you do the kinds of things that are required to look your best, you will find better health, even if finding better health might not have been your initial objective. There's a case that we're going to review in a little while that I think demonstrates that more than anything else. And I want to also make sure that people take away the fact that our appearance is more than just the genes that we have and whether we were born with an attractive face or a athletic body or whatever, a beautiful hair. It really is a matter of the total package, how you look, how you sit, how you stand, how you conduct yourself, your character. It's been shown many, many times that the person who is respected tends to command a little bit more attention from individuals. And Coach Bryant had it. He had that, what I call presence. When he walked into a room, the atmosphere in the room changed. Because
Elvis did that with Elvis. I mean, I just the whole these kind of yes, make a big difference.
So many of these famous people, they just had that countenance about them of such pride and dignity, and people pay attention to those kinds of things. And so, you know, if there's a person out there who's contemplating going to interview for a job, you can do a lot of things to help yourself. Pay attention to your hair. Make sure you're clean shaven. Wear clothes that look clean and pressed and coordinate them as best as you can. Sit up straight. Look the individual in the eye who you're talking with, who you're asking to give you an opportunity.
Absolutely.
Try to use the best grammar that you can. Yes, sir. No, sir. Yes, ma'am. No, ma'am. All of those things make a big difference. I know that not only from being in the appearance field, but also being an employer. Down through the years, both in Birmingham and in Gulf Shores, I hired a lot of people. And it's been shown many, many times that how you look when you walk in the door, before you say anything or before you hand them your resume, you either are going to make a positive influence on whoever that decision maker is, or you're going to make a negative influence on them or an impact, and you're going to have to then overcome that. So we just can't understate how important our appearance is, not only in our success in life, but how happy we are. And many times you'll find that there's a lot of prescriptions being written out there for antidepressants because people are overweight, when in fact if they would just get up and move around and lose a little bit of weight and get fit and feel better about themselves, the depression you could stop taking the drugs. And so that has a lot to do with the cost of things. And we don't have time in this segment to talk about all of these things, but I just want to make sure that people understand that this is not just about plastic surgery. Plastic surgery is only one component of what I do. Now, it really provides the revenue for me to do all those other things that I do. But I look at the entire individual, and we pay attention to their health. That's the first thing we do. You ask about the consultation. The very first thing we do when I meet with a patient is to check their medical history, to go over their medical history to make sure that they're healthy enough to have the surgery. And then we go into what we talked about with Judy, the psychological aspect. Why are they there? What are their motives? What do they want an improvement in their appearance with surgery to achieve for them? It won't save a marriage. It won't make you successful if you don't have skills and talents, but it can make you feel better about yourself. It can complete the package, so to speak.
And see, I like that because it's a fact of all of us, is that if we find a balance in our lives, and that's what you're saying is mainly, is if you talk with them about this, you've done more than just help them to make a decision about plastic surgery. You've helped them to really look at the mirror inside of them and make a difference. And I said that to my son for many years, is some of the basic things, just like for our viewers out there, it's the simple things. Even buffing your nails, guys, is still a good thing. I tell my son that all the time. If you're going to be in Hollywood and you're going to be a star, stay groomed every day like you are a star.
Mm-hmm. You never know. You never know who's paying attention to you and who might make a decision about whether to interact with you or not based upon the way you look. So if you really want to give yourself the best opportunity to succeed in life, just pay attention to the way you look in every aspect of it.
Well, could we show them, I'll get our producer to work with us, we'll get to show some before and after. Would you like to talk about maybe the nose? I mean, a lot of people today want to get their noses changed for different reasons.
Well, I think that will help us make the points,
Yes.
some of the points that we've been talking about.
Mm-hmm.
The first slide is a lady who moved to America from one of the Middle Eastern countries, and she had a very large nose, and she wanted to fit in better. And so we reduced the size of her nose, and you can see that it improved her overall appearance.
Amazing to me. Was that difficult? I mean, how do you do that? Do you like show them a mold of their face, or do you everything?
Not a mold, but I can take them.
On the computers today, you can do everything.
Well, one of the things that we do as part of the consultation, and I know we have some photographs of the consultation, but not only do I sit with the patient to go over those things that we talked about, but then we get in front of a three-way mirror.
Okay.
And I let them show me what their concerns are, and then in the mirror, I can actually show them what changes are reasonable and what we can achieve and what I don't think we can achieve as well, so that we have a meeting of the minds. And I think that's very important that they understand what my objectives would be. And then we have another case of a young lady who had a nose with a hump on it and a small chin. And this is a young lady that when she came in to see me would not look me in the eye. She was so self-conscious about her appearance. She kept her head down, and it took me a while to really feel comfortable in operating on her. But we did. We reshaped her nose, and we inserted a small implant in her chin. And her letter is in the book, The Appearance Factor. She sent me a letter later and told me how much it enhanced her life, not only her self-esteem, but she was getting more responsibility at work, and she'd gotten a raise, and she felt that that was a life-altering experience for her. Not just because it improved her appearance, but it improved the way she felt about herself.
Her self-esteem.
And she began to project herself a little bit more.
Now that's what it's all about right there. That has to make, how does that make you feel?
Well, this is why I go to work every day. This is what motivates me, and a lot of my friends say, well, why don't you retire? I can't think of anything I'd rather do than go where I go every day and do what I do. I'm just fascinated by it, and it gives me an opportunity to get to know people and to try to help them live better, balanced lives, and to enhance the quality and the length of their lives in many respects as well.
Southern Orthopedics specializes in all aspects of orthopedic care, from preventative medicine to corrective surgery. We offer the latest advancements in orthopedics, like our open MRI. With a commitment to excellence, Southern Orthopedics received the 2007 Orthopedic Care Excellence Award as awarded by Health Grades Hospital Quality. Our well-respected physicians bring 60 years of combined experience to their patients and the community. Southern Orthopedics and Sports Medicine Associates in Jasper.
Enjoy the latest books from Edie Hand, a portion of sales benefit charities such as St. Jude Children's Research Hospital. Visit www.ediehandfoundation.org or your local or online bookstore. Pick up your copies today. A Pocket Guide for the Alzheimer's Caregiver by Dr. Daniel Potts and his wife Ellen helps you understand this disease and get the best care possible. Go to alzpocketguide.com or any online bookstore for your copy. You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
To me, as we're getting to our next segment, to kind of give an overview of what we've talked about in this hour to everyone, is what probably is something that we could probably leave with them in getting that consumer out there to make them feel good today about the appearance matters, about themselves. If they wanted to come to see you, or what could they do for themselves before they came to see you? Do people get psyched out before they come to see you think?
Well, you know, anytime you start thinking about consulting a doctor, it's an anxious thing to do. I mean, I know I'm on the other side of it from time to time too, and you get concerned about going to see a doctor. You're afraid something is wrong. So sometimes you're afraid to go have it checked out, but that's the wrong attitude. If you're concerned at all about anything medically, you really don't need to hesitate. You need to get it checked out, because many times these things can be handled very simply with a small procedure or a medication.
You know, we've talked about different people's before and afters of things they've gone through in life, and just at the break we were talking about how this young lady that had a situation with her ears, and that how you helped to change her life. Would you share with that with our viewers?
Well, we could do hours on before and afters, but there are a few stories that really stick out in my mind. And the story is, several years ago, this was a lady in her 40s, and I was doing a surgery on her. She had very large ears that stuck out, and she wanted to have them corrected. So during the procedure, she was afraid of anesthesia, so we agreed to do it under a local anesthetic with a little sedation. And about halfway through the procedure, she began to cry. And I stopped and I said, "Oh my goodness, am I hurting you?" And she said, "No, you're not hurting me at all." And I said, "Well, why are you crying?" And she said, "Because I'm so happy." So I just put my instruments down and I said, "Tell me about it." And she said, "Dr. McCullough, when I was 11 years old, I went to a swimming party. And I got out of the water, and when I did, my hair was wet and my ears stuck out between my hair. And one of my friends said, "Oh my God, look at those ears." So everybody at the party stopped and looked at my ears, and I developed the nickname Ears as a result of that. And I was so self-conscious all through high school, I was called Ears. And she said, "I always wanted to have them corrected, but I was never able to financially until now." Now she was in her 40s. And she said, "But I want you to know that I have not been in a swimming pool since I was 11 years old, and I love to swim." She said, "However, last week, knowing that I was going to have my ears corrected, I have bought myself 3 brand new bathing suits and joined the club. I can't wait to get back in the water." And many times we don't realize how something that to us as an observer, we might say, "Oh, don't worry about that. That's okay. That's not that bad." To the person who has to live with them and deal with those issues, they're huge.
Thank you all for joining us today. Well, Dr. Potts, we had a great show with Dr. McCullough, didn't we?
We certainly did. And, you know, I'm thinking about going to see Dr. McCullough myself from my crow's feet.
You are?
Yeah.
Well, I'm going to get nipped and tucked first.
You can go first. I'll go second.
Okay.
It's fine. We really appreciate you joining us today, and we hope you'll join us again next week on Prescription for Healthy Lifestyles.